Good morning, everyone. It's hard to believe that it was only 1 month ago today I declared a state of emergency to address the COVID-19 pandemic. Since then, we've taken many extraordinary steps to slow the spread of this very contagious virus, steps that are saving lives. But Vermonters have stepped up to the challenge by staying home, which I know has been difficult and has had a tremendous impact on your daily lives. I also know that extending the state of emergency was a disappointment for many. So again, I want to be clear. We will continue to watch the trend in our hospital capacity so that as soon as we can begin to dial back some of these steps in a measured, responsible, and safe manner, we will. At the same time, we've been working hard to help get money into the hands of Vermonters as quickly as possible, and working on new ways to help each of you get through this. And while we've seen a flattening of the curve, we still don't know if we've reached the peak. So as difficult as it is, we must continue to stay home so we don't overwhelm our hospital system and we keep our healthcare workers safe and on the front lines of this pandemic. I can't say this enough. Your sacrifices are making a difference. Just a few weeks ago, our worst case scenario showed that if we had done nothing, our hospital system would have been overrun with 2 to 3 times as many cases as we had hospital beds. Reaching that point would have cost thousands or hundreds of lives. And remember, these aren't just numbers. There are parents, grandparents, friends, and neighbors, members of our communities who spent their whole lives helping us. These are the people you've helped keep alive. I hope you all realize what a selfless gift this really is. While I know it's been incredibly difficult, you're protecting the vulnerable, as well as healthcare workers and emergency responders across the state who put their lives on the line for us every single day. In fact, we've been recognized as one of the top 5 states when it comes to complying with mitigation measures. And if these trends continue and we continue to flatten the curve, we'll slowly be able to get back to normal. Although it may be a different normal than we had before. My team is working every day to look for ways to get Vermonters back to work safely and responsibly, and just as soon as we possibly can. Working closely with public health experts, we'll open up the economic spigot a quarter term at a time to do just that. I know many just want to get this over with right now, and others are worried we'll move too quick before the virus has run its course. So I want to assure you, I will continue to act based on the data and science and working closely with the experts to make the best possible decisions I can for Vermonters. I also want to assure you we will get through this. At a time in history when the country has felt so divided, we've shown just how united we can be. And that when our back is up against the wall, when lives are at stake, we can come together, put the needs of others before our own, and serve the greater good. Vermonters, united together, can achieve anything, and we'll get through this stronger than ever before. I'll now turn it over to Commissioner Levine for his update.
Good morning. I'd like to cover 4 things this morning. Give a brief update, talk about facial coverings, spend a moment on tobacco, and talk about serologic testing. So the first item is where are we now? And as of midnight yesterday, we had 21 additional cases, but that was out of a total of almost 500 tests performed. We now are just shy of 750 cases in the state. We also unfortunately had 1 additional death. The number of new cases per day is getting smaller, and it's leveling off. We seem to be approaching, if you will, a plateau. We'll see if that is a sustained phenomenon or just a trend over several days. But the important thing to note is that we are, in the general population of Vermont, not recording major outbreaks or spikes in our data. We have in our vulnerable populations, whether they be housed in a long-term care facility, nursing home, or in one case a correctional facility, outbreaks that are noteworthy. But I think to tag along to the governor's comments, we wouldn't be seeing this type of experience in the general community if the strategies that have been employed to date were not successful, and if, as you will, the compliance that the governor referred to had not been so good. So we thank you all for that. Second thing I'd like to share is an experience I had this weekend. I had the opportunity to frequent one, we'll call it big box store, and one medium-sized supermarket. I found lots of people wearing facial coverings, both in the ranks of those who were frequenting the stores as well as those who worked at the stores. But I also found noteworthy exceptions. These brought me back to my days in high school and on college vacations when I was one of those employees in a supermarket. And I realized that many of them, whether they've been told not to wear a facial covering or whether they just chose to not wear one, are putting themselves at extreme risk. Because we've told you that people can be in a pre-symptomatic phase with COVID for about 48 hours, and one would not know that you could get infected by them. Likewise, if it was one of the employees who perhaps was stocking a shelf or bagging items for you as a customer, and they did not have a mask on, one would be potentially able to get infected from them if they were in a pre-symptomatic phase. So again, I strongly urge the use of facial coverings. Those who are frequenting these essential stores where we must go because we need to survive with food and drink while we're in this mitigation period, and those who manage, supervise, or are those employees, all should be wearing facial coverings. Moving to tobacco, some incredible statistics. You may recall a number of press conferences ago I mentioned how the timing may be right for many who have been thinking about quitting to do more than think, but to try to implement that thought into some kind of an action plan. Well, I can't tell you quit rates have suddenly changed because we don't measure those in the matter of days or weeks, and we measure those more 6 months and 12 months later. However, if we look at registrations to our 802 quits programs, both by phone and by internet, in the month of March, and compare it to March a year ago, we find that there was a 41% increase in phone registrations and a 167% increase in web registrations. That's phenomenal, remarkable. I congratulate all those who represent those statistics and urge others to try to implement themselves. Finally, serologic testing. What is serologic testing? It's testing one's blood to see if there are antibodies, in this case, to the coronavirus that causes COVID-19, the illness. So it implies that you have been infected with the coronavirus, whether you had an illness that you could clearly state was that illness, or perhaps whether you were asymptomatic and received the infection being out and around in society, but really had no knowledge that that had happened. Serologic testing is clearly going to be an important part of our future strategy, a critical part, I would say. Right now, at this stage of the pandemic, it's much more important for us to know who is actively infected by using the PCR test from the nasal swab. While it's important to move quickly on all fronts, including containment, mitigation, and assessing new therapies, the serologic testing front should focus on accuracy of the tests and identifying their role over time. At this point in time, we cannot and will not abandon the containment strategy. If in the general population cases keep appearing of coronavirus, we do want to know that. We do want to isolate. We do want to contact trace and quarantine as appropriate. That is how you bring an end to this epidemic. But as we enter this plateau phase now, and hopefully a deceleration phase to follow, it'll be more important to assess who has antibodies to the coronavirus for a whole bunch of reasons. First of all, to know who is immune. We don't know yet what immunity will mean. We know that other coronaviruses that have affected humans, one can get repetitively through their life. We don't know what that means with regard to this coronavirus. It also allows us public health folk to do what is called health surveillance, so we know how much is in the population. Knowing immunity will help us know who should be prioritized to get a vaccine when and if a vaccine is available. People have heard about plasma donation, taking plasma from people who have been infected and have antibodies and giving them to be used as treatment for the most critically ill patients in ICUs with coronavirus. That does not yet have the stamp of approval from the scientific community, and it's only being used experimentally, but it could be an important future initiative. Return to work, especially for healthcare providers, so that one can preserve and protect the healthcare workforce and perhaps have people out of work for less periods of time. And just to know from this health surveillance standpoint, who in our population still is vulnerable, who in our population may have had an asymptomatic infection completely, how much more social distancing should go on for how much time. Now, with any test, there's always a risk of false positives and false negatives, which can lead to, if you're a false positive, being falsely alarmed, if you're a false negative, being falsely reassured. So we really do need a good test and an accurate test. There are literally hundreds of tests that are now trying to market themselves and queue up with the FDA to say that they have a wonderful test. To date, the FDA, I believe, has only approved one test. We want to move on this front as fast as possible. So over the weekend, I appointed a working group comprised of both adult and pediatric infectious disease clinicians, primary care physician, laboratory experts in serology from both the UVM lab and the Vermont Department of Health lab, and public health surveillance experts. Their timeline is before the end of this week. We will do this in Vermont, but in a scientifically and public health informed, deliberate, strategic, and evidence-based manner. Thank you. I believe Secretary Smith has a few things to say.
Thank you, Dr. Levine. I've got a few updates, issues that happened over the weekend that I just want to update all Vermonters on. As you know, the COVID-19 pandemic is unlike anything our state and country has ever experienced. It's going to take all of us working together to help our state and neighbors recover. We have been working with community partners around the state to find places where those who cannot safely isolate can recover before returning to their community. That can mean a variety of populations, from healthcare workers to others that don't have a home to safely isolate. I want to announce that the Isolation and Recovery Center in Chittenden County will be located at the Holiday Inn in South Burlington. That should be operational the first part of this week, if not today. What is the Holiday Inn being used for? Starting this week, the location will be used as our primary isolation site for COVID-positive individuals who do not need hospital level of care, but cannot return to their primary place or location of residence. This is a temporary arrangement during this time of crisis. When the crisis is over, the Holiday Inn will return to regular operations. You may ask how many people will be housed at this new isolation and recovery center. The maximum number of individuals who will be housed there is 150. The staffing is planned to serve that many if needed. How long will the site be in operation? We anticipate that the state will use the location as an isolation site during the COVID-19 state of emergency. The timeline will depend on the needs of Vermonters and those being cared at the location. How long will the individuals be there? Well, we will support the individuals isolating here until they've recovered from being COVID-19 positive and can be medically discharged as determined by healthcare staff. Will there be security on site? The answer is yes. And what about the individuals who are currently housed at the Holiday Inn through the state's emergency housing program? They will be relocated to another facility, another hotel in Chittenden County. The second thing I want to update is the placement of COVID-19 positive inmates to the St. Johnsbury facility. I want to talk about it because there has been some people concerned about that and the pace at which this happened. I wish we had much more time to use the normal pace of dialogue when we have to do the placement of facilities and people, but the fact is we don't. And conversations that would normally be held over months by necessity are now done in days, as we look to handle all populations in a safe and responsible and caring manner. Do we get everything completely right? Probably not. Even though we have a solid transportation plan for the COVID-19 patients that need hospitalization, we probably could have communicated that plan more efficiently and effectively in St. Johnsbury so the local hospital didn't feel they would be overwhelmed. But with that said, I got to tell you, I'm so proud of Vermonters. We opened surge sites at Patrick Gymnasium, at the Champlain Valley Fairgrounds, a hockey rink in Rutland, a surge mental health facility in Essex, and possibly in Springfield, a special population facility that I just mentioned in South Burlington, and others around the state. Vermonters have rallied in support of their fellow Vermonters, and I thank them for that. There have been instances that we've heard about that raise some concerns. The promotion, for example, or the idea of having people that are COVID positive wearing uniforms designated them as COVID positive in our isolation or recovery centers. Please remember that any one of us could be in this situation. So we oppose sort of putting up in these recovery centers any sort of special uniforms or special designations. We've learned from history about that, about doing things like that for COVID positive patients. But fortunately, I think those comments are really in the small minority. But the vast majority of Vermonters, I gotta tell you, have just been absolutely compassionate. Back to St. Jay, we'll listen to concerns to help mitigate local concerns. We have Commissioner Baker and Superintendent of Facilities Al Comier will be meeting with the Select Board tonight. We'll continue to meet with legislators, local officials, and hospital administrators to make sure that our plans are in place. But I do want to reiterate, we've been planning for a few weeks for the possibility of positive inmates within the Department of Corrections. The plan includes a need to identify a space to house COVID positive inmates who do not require hospital level of care. We have been doing outreach to local officials, state officials, legislators, the news media, as we have developed these plans. And we will continue to do that on an as-needed basis as we move forward. The other area that I just want to spend some time talking about is over the weekend we did a major testing of a Burlington Housing Authority facility called Decker Tower. Decker Tower is a senior living facility owned and operated by the Burlington Housing Authority. Recently, we have had 2 deaths in the last few days there. One of those deaths was not COVID-19 related. We are performing tests on the other person who has died just recently. Although deaths may be common at a facility like this, we take extra precaution because this is a senior living facility. The fact, coupled with a self-reported COVID-19 case in that facility, has led us to the conclusion that we needed to begin testing of the entire facility, and we did that on Easter. Yesterday, on Sunday, we began testing. The health department, with a staff of 9, were on site to assist testing. We tested 139 residents there yesterday. We'll continue testing today because some residents weren't there and some staff weren't there. We'll continue testing at that facility today as well. I do want to talk about a little bit about the Veterans Home in Bennington. There are 122 veterans and 200 staff there. We have no current COVID-19 positive patients or staff there, but on March 15th we had a staff member who was tested and was positive COVID-19. That staff member isolated for the 14-day period, was given 2 nasal swabs, both negative after that period, and so that was March 15th, so obviously it's past the 14-day mark in terms of what's going on, but out of an abundance of caution, today we are beginning testing of that entire facility as well. So we will let you know the results as we find them out, but I wanted to give you an update on a lot of happenings over the weekend. Thank you.
Thank you, Secretary Smith. We have a number of other commissioners and secretaries on the phone, and we'll open it up to questions at this point.
All right, we're going to open it to questions. Just for everybody's awareness, it's 11:30 and there are 20 people in the queue, so please just remember one question. If you do have follow-ups for clarity, that's fine, but just try to remember all of your colleagues in the queue. We're going to start in the room with Stuart.
Governor, can you clarify what the plan is for food for farmers markets going forward this summer? There seems to be some confusion about shutting them down completely, or whether the administration is going to provide sort of some restrictions that you alluded to last week.
Yeah,
for food producers.
You know, every sector is important to us here in the state, and I would say that the food supply sector is more important than others. We want to see farmers markets open back up in a normal way, but at this point, we're not comfortable in doing so. We will take a phased approach. There'll be some restrictions. I think you can expect that the farmers markets would be amongst some of the first to open up in a much different way. But our intention is to open up them as well as every other sector throughout the coming months as we watch the trends and make sure we're doing so in a safe and responsible way.
By summertime?
Very tough to put a timeline on this. I think I've watched others who have given timelines and then you're over-promising. I want to make sure that we're doing this with all the best information we have. And again, as I said the other day, there's no one who wants to open up the economic spigot more than me. So we will do so just as quick as we possibly can.
Calvin?
I believe Secretary French was on the line as well, so it's probably a question for him, but just wondering what the Department of Education is hearing from teachers, families, students about sort of the continuity of education, how that's being rolled out, and what concerns for so far.
Secretary French, are you on the line?
Yes, good morning, Governor. I believe the question was about concerns from families and students.
Just wondering
I think,
about
yes.
I think it was about the teachers as well, and administrators, as well as students and maybe families.
Yes, I think, as one could expect, it's been very challenging and folks are rising to the occasion, but it's been very uneven and a lot of hard work on the part of schools and families. So I think, in particular, the issues of equity and access to learning materials as they were manifest when we operated school are increased challenges in this environment as well. So folks are working hard at it, but we definitely have some challenges statewide to ensure all students have access to high-quality learning opportunities during this emergency.
And then I just had a quick follow-up as well. So the legislature has been sort of dealing with some security issues with Zoom and other video conferencing. I guess, what is the Department of Education doing to making sure that these are secure lines and that we're not running into the same security problems that some lawmakers have?
Yeah, we've specifically relative to Zoom, we put out some guidance when those security issues were becoming more apparent that we discouraged folks from using Zoom. School districts have other options available in terms of video conferencing and sharing materials, so we encourage them to use other platforms if they have them available.
Thank you.
All right, we'll go to the phone now. The first caller is Aaron from VT Digger. Aaron, *6 on you.
Yeah, hi. Can you hear me?
We can.
Okay. My question is about contact tracing. Massachusetts said it's deploying 1,000 contact tracers to combat the spread of the virus. I was wondering if Vermont is taking a similar step to step up its contact tracer effort. And could you tell us a little bit about who is doing contact tracing right now and essentially how they're doing it, how they're strategizing around contacting so many people because this is such a widespread epidemic?
I'll let Dr. Levine answer the question, but I just want to remind everyone the population of Massachusetts is about 30 times what Vermont is. We've taken some incredible steps here early on to try and cross-train in order to do as much tracing as possible. So, Dr. Levine?
And if I quickly do the math, 30 times 42 is over 1,200. So we've done the equivalent of Massachusetts because we've trained 42 plus minus officials from the Department of Public Safety, police departments around the state, detectives, etc., to augment the public health workforce that's already doing that work. So, your question comes at a good time because we just had a case of a positive individual who works for a home health agency, and there were some issues around that individual and trying to make sure we could ascertain who they'd been in contact with, and we were discussing it with the home health agency, and the public health official in my department who was discussing it mentioned the need to do effective and comprehensive contact tracing, and the response on the other end of the line was, "You're still doing that? Fantastic, we want to help you in any way. We thought all the states had stopped doing that already." And in fact, based on the kind of the tone in your question, that has happened in other states. We are maintaining, as I've said in previous conferences, parallel course of the mitigation strategies we're all involved in with stay at home, stay safe, and containment. But it does get complex, as you allude to. So every time there is a positive case, it's taking a complete history, and it's really working with that individual, somewhat open-ended, but also through some structured questions to really ascertain anyone who may have had close enough contact that they should be questioned themselves and informed. So it's a very methodical process. It's basically public health 101, if you will, and no one's veering from that course in Vermont at this time.
All right, Kat?
Thank you.
Kat, WCAX?
This question is also for Dr. Levine. Dr. Levine, you indicated you don't feel the science is necessarily sound yet on these serology tests. So what kind of scientific evidence will you need to see before you give them your stamp of approval?
Yeah, it's not that the science isn't sound, it's that the validity of the tests isn't sound. So if a test has 80% sensitivity, that means that 1 out of 5 people who might be positive will actually show up as a negative test. To me, that's not a very good test. Likewise, if it's not a very specific test, 1 or 2 out of 10 people might actually be falsely alarmed that they are positive. So all I want is to know what the best test is out there that has undergone the scrutiny of the scientific community and that we can rely on so that we can be appropriately telling Vermonters who happen to get the test what that means for them. You know, this, in a sense, this is a big screening exercise. You know, and one of the principles of screening tests is, of course, do no harm. So we want to make sure we are only doing good and not doing harm. And it's amazing how little it takes in screening to do harm. I would just refer you to the literature on something that most people take for granted nowadays, mammography in women in their 50s. Turns out that the likelihood of having a false positive mammogram, if you get mammograms at the interval you're supposed to get them over a decade, is quite high. And a false positive for that woman means not only perhaps having to repeat the mammogram or get a different type of test to confirm or refute what was going on, it might also mean getting a fine needle biopsy or something more dramatic. But at the very least, it creates an anxiety that when you go back and interview women who've had a positive test that didn't mean anything, stays with them subsequently for years. So we have to be very careful when we talk about tests and making sure that their validity has been tested and that they are truly accurate. And again, the science is moving as fast as everything else with coronavirus. So we just have to be aware of all of that. Does that answer your question?
It does. I do have a quick follow-up, though. So Copley Hospital is testing their staff with the serology test. Should all hospitals be doing that so that they know which of their workers may have already built up some antibodies?
Yeah, so I think, as my comments earlier alluded to, hospitals and healthcare workers are prime candidates for this test, especially in maintaining and restoring the healthcare workforce. I would like to see even a better test than Copley's using be more widely available at this point in time. And of course, one has to realize testing is voluntary, so it can't be imposed on anyone, although I think the test will be simple enough, and hopefully if it's accurate enough, it will have acceptance by all those out there. But I do foresee it having a great role in the healthcare setting, for sure.
Last question related to serology tests. How long until Vermonters can get them?
Like I said, the work group is going to actually have recommendations ready by late Thursday, and we'll then determine exactly what the state of the art is and state of the science is, and in an informed way we'll make a decision.
Okay. Thank you.
Okay.
Colin, 7 days.
Hi, this question is for Secretary Smith. Last week, you had cited figures about elderly inmates, sort of supporting why you don't believe many of them should be released, referring to them as hardened criminals, a lot of them. And I think the ACLU and others are calling upon the state to also furlough inmates who are medically compromised or who are incarcerated on technical violations. I was wondering if the department could provide figures for the number of inmates who fit those criteria.
Colin, I will reach out to the department. I don't have those in those areas, but I will say this, and I will reiterate this as well. We are not in the business of releasing people who have done significant and severe and violent crimes. If there are, I think I said this last week as well, if there are situations that are one-offs over there that we haven't reviewed already, we're willing to review. But I got to tell you, we've done a lot of review in the last few weeks, and we think we are in, we have done a compassionate and thorough job, but I will check with corrections. But I do want to reiterate one more time, there are, I keep hearing that we should release people over 60. Well, I read that list to you last week, and there are some violent people in that list, and we're not releasing them. So thank you, Colin. I'll get that information to you.
All right, thank you. Well, I'm going to ask one more question then. This is for the governor. President Trump has been talking about his ability to open states sort of at the federal level, and I think there's been some recent reports that he's hoping to, he's thinking about doing that by early May, which would obviously come before our stay-at-home order expires. Could you just talk a little bit about your thinking of what you would do if the president calls for states to open up and you don't see it the right time?
Well, again, we're going to do everything we can here in our state to protect Vermonters in the way we've been doing so over the last 4 or 5 weeks. It didn't take federal action to spur us into action, and it's not going to be the federal government that's going to determine when we take appropriate steps here in Vermont. As we watch the data and I listen to the experts and we see the trends that we're seeing, we'll take those steps because, again, I want people to get back to work, but to pick an arbitrary date, I think, is irresponsible. It might give some people hope, but if we have a false start, if all of a sudden we open up the spigot and people go back to work, and then all of a sudden everything spikes and gets out of control, and we have to take and shut the spigot off again, there's going to be a lack of confidence in government. And I think at this point in time, we want to make sure that we're doing it for the right reasons and doing it, again, in a responsible way.
Thanks.
Greg, County Courier.
Hi, Governor. My question is about VTrans logging, who comes and goes from the state. We're seeing VTrans employees sitting at the Canadian border logging as little as like a dozen cars in an 8-hour shift. Isn't this pretty duplicative of what the federal government already collects for data as who comes and goes through that border? Additionally, I'm wondering if the labor from these VTrans workers would be better utilized working on roads, especially when traffic is dramatically increased. And lastly, we've been doing this now for about 2 weeks, I believe, collecting data of people going from the state. What are we learning from that data?
Okay, I'll try and take one at a time here. In terms of the Canadian border, we, as you might remember, we don't share a lot of data with the feds unless necessary, and they don't necessarily share everything with us. So this data that we're obtaining is to try and tell us traffic patterns, who's coming into the state, who's leaving, and so forth, just by state and you know, in terms of a country as well. So as well, I have spoken to VTrans. We will probably narrow down the number of ports of entry, or we'll continue to take data. What it's telling us is we have a significant amount of travel between New Hampshire and Vermont. Probably not surprising, but that's where most of the traffic occurs. Not as much as what I had thought in terms of there was a huge outcry and those coming from New York and Connecticut and New Jersey and so forth, and the data doesn't back that up. So that's alleviated some of my concern. In terms of whether they should be working on the highways or not, again, they're under the same conditions that we are, the private contractors as well. That it's a stay home, stay safe type of approach. They're there ready to go if there is an emergency, and we'll put them out on the roads when that happens. But we don't want to put them out for no reason at all. So hopefully we'll get back to normal or some semblance of normal, and we'll be able to get those the state crews back out, trying to patch the roads and make improvements and provide for safe travel. But I understand the concern. But at this point in time, there was a number of people, probably not as much up in your region, but down in the southern part of the state, who had tremendous concerns about who was coming into the state. So we just wanted to collect the data to get a baseline.
So just to be clear, have the feds said that they won't share data as to who's crossing, or
we haven't asked them for that data, but typically Border Patrol and others keep that information to themselves.
All right, thank you.
Andrew, Caledonia Record.
Yes, good morning. My questions, if you'll excuse me, obviously revolve around the prison in St. Johnsbury. First is for a point of clarification. Can you say who is housed at the correctional complex right at this moment? Is it just the transferred infected prisoners, or are there non-infected prisoners still there? Along those lines, DOC has said that the staff at St. Johnsbury have been trained to avoid infection and will have the proper equipment. But 16 staff at Northwest have already tested positive. I'm wondering how the training and equipment is different in St. Johnsbury than it was in Northwest. And if training and equipment are sufficient to protect the staff, why are people over 60 and with medical conditions not being assigned to that duty?
I'll let Secretary Smith answer those.
Let me try to answer those if I can remember them all. The first one is how many are at the facility. There are, let me think, 28 COVID positive patients that have come from St. Albans to the St. Johnsbury facility. There are 25 that are non-COVID prisoners who have not been transferred, primarily because they have duties there at the prison, such as making meals in order to sustain the prison operations there. Now, those people are separated by a wing in that facility. The other ways that are separated with the COVID positive plus the COVID negative patients is both plastic and a plastic sort of barrier, plus today also plywood barriers. They have separate instances or separate entrances for each of these populations. One of the you talked about the correctional officers up there. They have a decontamination unit. They have been trained in donning and taking off a PPE in this area. They've been trained in PPE. The other areas where we have COVID, we have positive COVID inmates in that facility in St. Johnsbury. So we do have training for those people. We have training for the other correctional officers as well, but we did not have, until just recently in St. Albans, a positive case. We had three correctional officers that tested positive, and then an inmate, and that precipitated us testing everyone in that facility and then transferring over to the correctional facility in St. Johnsbury. Did I answer all your questions? I'm just trying to make sure.
Yeah, nearly did. So can you just clarify the equipment that was being used and the training that was given to the staff, was the protocol different in Northwest than it will be in St. Johnsbury?
Yeah.
And is that the assurance that you're trying to offer to the St. Johnsbury folks?
Yeah, there is different protocol. There's a decontamination tent outside the facility in terms of what is going on. Look, this is contained. This is contained within a facility, just like a healthcare facility, for example, or other facilities like we did at the Holiday Inn that we just talked about in South Burlington. This is contained within a facility. I can assure the people of St. Johnsbury that they will not contract COVID-19 from a prisoner up there. We are monitoring all our employees up there in terms of COVID-19, and we have various procedures that were put into place in St. Johnsbury that are above and beyond what we have in other facilities. So the answer to your question is there's adequate training, there's decontamination procedures in place, there's separate instances, there's two distinct populations up there that are separated, and plus the medical staff, plus PPE that is donned in the appropriate way.
How can you be certain, though, that a staff member isn't going to clock out, be asymptomatic, hit the grocery store on his way home to help his kids do their homework, and all of a sudden it's spreading faster in the kingdom than it otherwise would be?
How can I be assured that that's not going to happen with a healthcare worker? How can I be assured that's not going to happen with anybody in the population? I can't be assured with this type of contagion. The fact is, we're putting all the procedures into place in order to do this. The fact is, we probably don't know of all the people right now, including in the Northeast Kingdom, that have this disease, in this virus. In many cases, it goes undetected within the community, and that has been the trouble with trying to get a handle on this in terms of what is going on with this particular virus. But at the same time, I gotta tell you, when you start looking at the numbers and what the governor has done to sort of mitigate what could have been in Italy or in New York or something else, it's pretty impressive in this state what we've done. So I can't give you an assurance, but I can tell you we have put measures into place to give as much assurance as we can.
Okay, thank you.
Tim, Vermont Business Magazine.
Good morning. Perhaps Dr. Levine can answer the first question and the governor can answer the follow-up. It's about the hospitals. We had a comment from a nurse here in Burlington that said they've never been less busy, and I'm guessing that, as Secretary Smith just mentioned, the impressive response to the mitigation efforts has kept the populations down in the hospitals. But there's also concern about people being fearful who going to the hospital who might otherwise really need some care and not getting it because of their concern there. And the follow-up for the governor is, would elective surgeries be one of those early spigot turns to open up the economy because the hospitals are doing so badly economically?
I'll answer the second part first, Tim. Obviously, elective surgeries are something, whether it's a hip replacement or shoulder surgery or hand surgery or some other elective surgery, are what are the source of revenue for many of our hospitals throughout the state or anywhere in the country, actually. So I'm very aware of that. Again, we're going to look at all sectors in terms of how do we open up the spigot just a little bit and provide for that sense of relief. But we want to make sure, again, that we don't overwhelm the capacity, that this trend is accurate and long-standing. And then we'll be able to monitor as we do open up the spigot to be sure what we're doing is appropriate, that we don't have to take any actions to shut it back down. But it is on the list. Those elective surgeries are on the list. The hospitals are just another business like any other sector in Vermont.
With regard to the first question, that could be a concern that people are not taking care of things they might have taken care of at a different time in our history. But at the same time, we get reports every day about the number of COVID patients in hospital beds and in ICU beds and the number of beds that are occupied. And the COVID patients, fortunately, I guess, are a minority. And there are still empty beds, but there are also beds occupied by people with other illnesses. I want to remind everyone that even though the traditional presenting to a doctor's office or an urgent care clinic may be happening less often now, there is telehealth. People have the options to be on the phone alone or be on the phone with video capacity and have their concerns heard and have many times their chronic medical conditions managed quite well without being present in person. So healthcare hasn't disappeared completely. It's actually reinventing itself in a new way. And I think in the aftermath of what we're going through, we're going to learn a lot more about how we might actually still learn how to take care of ourselves and be effectively managed from a healthcare standpoint without presenting to a healthcare setting as frequently as we may have in the past. But I would certainly urge people to not suppress concerns and have symptoms that they would have regarded as serious at one time and are now telling themselves, I better not talk about it because I don't want to have to go to a place that might have COVID, because you still need to really take care of yourself. And even if it's just getting guidance on the phone, that can go a long way to either reassuring you that you're doing the right thing by staying home, or, as needs be, having you present to a more urgent care or emergency setting to have that taken care of.
Thank you.
Neil, the Vermont Standard. Neil, *6 to unmute. All right, we'll move to Avery, WCAX.
This is probably for Commissioner Harrington. Can we just get a brief update about how the processing of unemployment claims are going and what people kind of expect as this new week starts?
Commissioner Harrington.
Yes, happy to jump in here. So we're continuing to process claims. The number of initial claims is leveling off a little bit over this past weekend. Initial claims opened were under 1,000 for Saturday and Sunday. Monday, though, are typically busy days, so we'll see what tomorrow brings. And people are continuing to file their weekly claims. We did have a system outage yesterday, which caused a lot of claimants who tried to log in or dial in to get a message saying that their social security was not found. As soon as we found that out, we posted messages online and let people know. My understanding is everything should be functional now. People can still file their claims online and over the phone if they're for the rest of the week. So there should be no outage there issue. Again, hard to tell. Again, it's the first full day that we've been asking people to follow the alphabetized schedule, but hoping that begins to alleviate some of the pressure, both for filing claims online as well as our claimant assistance line. And we are bringing some more state staff and other partners online to assist with both clearing issues off of claims and also handling some of the, we'll call it, easily resolved issues on claims, and should have all of that at least up and running in some way, shape, or form later this afternoon. Does that answer your question?
Yeah, thank you.
Hey, Commissioner Harrington,
Absolutely.
while I have you on, can you give the alphabetical order again for this week so listeners can understand that?
Yeah, absolutely. So again, if you are willing and able to file your weekly claim by phone, there are no restrictions if you're going to do it by phone. So we encourage everybody to do it that way. There's just way more ability of the phone line to handle this, and that is 800-983-2300, 800-983-2300, and that is Monday through Friday from 5 a.m. to 4:30 p.m. If you are going to file online using the web portal, for Monday, it's last names that begin with A through E. For Tuesday, it's F through L. Wednesday is M through R. And Thursday is S through Z. And then Friday is open because there are some people we have to make sure go in by the end. And if there was an issue, we'll need to resolve that. For the claimant assistance line, for people trying to get issues cleared off of their claim or have questions, I will say that we have seen major traffic on this line, and part of that is due because people are dialing, 100, 200, 300 times a day, and it just overloads the system. So again, I'll just call on the public. If you can follow this schedule, it should help us alleviate the number of calls coming in at any one time and get you into our queue. So for Monday, for the general assistance line, it's A through E. Tuesday, last names beginning with F through L. Wednesday for last names with M through R. And Thursday, F through Z.
Thank you.
For Friday, Friday and Saturday, those call lines are open for everybody. Thank you, Governor.
Thank you very much.
Patricia, Bennington Banner. Patricia, *6.
Hello, can you hear me?
Yes.
We can.
Wonderful. I actually am thinking this question would probably be for Dr. Levine. I heard you mention this earlier. I just want to clarify. I know what's up. You mentioned the work group. I just wanted to clarify what exactly their task is and what the deadline they have for that task is.
Sure. The task is to assess the performance characteristics of the tests that are available out there, to come to a conclusion about the most appropriate timing of using these tests on a population basis, and to make sure that they can recommend the most appropriate use. Timing is one thing, but use of the tests for what purposes. Never want to order a test without knowing what you will do with the result. So very important to have perfectly framed out the kinds of criteria, if you will, that we might set for using such a test. And late Thursday is their timeline. And again want to emphasize, this is not for people who think they may have COVID now We continue to want them to get the current test, which is the PCR test. That tells you that you have an active infection going on, as opposed to the test we're talking about here, which shows that you may have had experience with this virus at some point in time in the past, whether it be known to you or not. I can get a little bit in the weeds. There is an IgM and an IgG component to the test. The IgM is more acute, but really we want to emphasize the testing we have now for the acute infection, which is the PCR test.
And the test that, or the group assessing the performance characteristics of the test available, that is specifically serology tests for coronavirus antibodies, correct?
Correct.
All right, thank you.
All right, Lisa, AP.
Hello, can you hear me?
We can.
This is for Dr. Levine. How many of the 28 deaths, COVID deaths that we have in Vermont were in nursing homes? And how does Vermont rate of deaths in nursing homes compared to other states that have had significant outbreaks?
Yeah, so we'll get back to you with the precise numbers. The majority of our earliest deaths were in nursing homes, but really that number has sort of stopped increasing at much of a rate, and a lot of the subsequent deaths have been hospitalized patients who may or may not have been nursing home, but most of them, I believe, were not nursing home patients. I believe we are third in the country for deaths as a percentage of the population per capita. Does that answer your questions?
A third in the country of, you mean in deaths in nursing homes?
No, per capita, number of deaths in this epidemic.
Oh, I see. Okay.
They do tend to all be in elderly people for the large majority.
Right. It just seems like in Vermont we did have some outbreaks, but we didn't. It doesn't seem like the nursing homes have been hit quite as hard as in some other parts of the country, and I was wondering why that is. Are we doing something differently?
Right. So, the initial nursing home in Washington State, I think there was something on the order of 41 deaths in that nursing home, which was quite large. Even where we're showing large numbers of infected people in the 2 Burlington nursing homes, we haven't had death rates to that extent by any means. We've done a lot of work and are continuing to do a lot of work. And I do really want to call out our EPI part of our public health department and infection control. We provided a lot of guidance materials for prevention early on. And then when we saw a few of these outbreaks develop, we doubled down on that again. And even as we speak, last week and this week, we're coming out with even firmer guidance. Because again, that's where the hotspots are in Vermont right now, in these vulnerable populations. And we're trying to make sure that infection is not introduced unwittingly. Now that might be by a visitor, but we've really restricted visitation, so probably not that route. And it might be by a staff member, and the staff member would not do it purposefully. It would be unwittingly because they were in a pre-symptomatic or asymptomatic phase. Or it could be by a new admission to the facility. So this week we're actually have new policies regarding if a person was hospitalized for a non-COVID illness, they still must have a COVID test prior to discharge to a nursing home facility. Even if that test is negative, we've advised that the facilities quarantine the new admission for the appropriate 14-day period. So again, the staff would be using full PPE, making an assumption that that case could be infected. We're also having a new policy on masking at all times in these facilities. So we've done a lot already for prevention and proactive work. Now we're trying to double down even further with some more stringent regulations that will, again, protect this very vulnerable population. Thanks for the question.
Thank you.
Chris Roy, Newport Daily Express. Chris? All right, we're going to move to Michelle Monroe, St. Albans Messenger. Michelle, St. Albans Messenger. All right, moving to Brittany, Local 22.
Yeah, my question is, I was just wondering, I mean, Dr. Levine, you mentioned about going to grocery stores and seeing essential workers not wearing masks, but people in the stores wearing masks. In the future, can we see an order that all essential workers should be wearing face masks?
I think you can expect that when we start opening up the spigot, as I keep talking about, and allowing more businesses to go back to some sort of normal, there'll be restrictions on those businesses. So I think you can expect the executive order or addendum to the executive order will contemplate that, and there will be some provisions there to protect ourselves as well as others who are out there working.
So if you open the spigot, then you might require that, but I'm talking about like right now, people who are they're working at grocery stores every day. Is there anything in the future to put that in order maybe this coming week or next week, or is that still just in the talk?
Again, I think you can expect something in the next, this week at some point in regards, depending on what we see with the trends, to some changes to the executive order.
Okay, thank you.
Liam, VPR.
Hi. So as we start to sort of slowly move towards May 15th and businesses potentially opening back up and people go back to work, are you contemplating any guidance or orders around how businesses should sort of approach allowing people some flexibility, since a lot of folks that have kids would potentially have to go back to work and still have to do some stay-at-home or remote instruction for their children. So are there any guidance or orders that the state's developing to make sure people don't have to choose between their job and continuing education for their children?
Well, again, we'll be considering all those factors when we impose the changes in the executive order. That's the ripple effect that we're concerned about as well, that we don't do anything that would unnecessarily hurt people. We're actually trying to help people and get the economy turned back on. But again, those are all the considerations that we're contemplating as we move towards opening up to the new normal.
But I mean, is there going to be a consideration or like kind of a way to protect, make sure people aren't going to lose their jobs if they have to take some time off to deal with their kids? Is the state going to do anything there?
Again, I would say that those are all considerations that we're contemplating at this point in time. That's why it's not as easy as to say we're going to flip the switch open, because there are other provisions, other things that might prevent someone from coming back. So again, we're trying to contemplate all of those as we try and open the door a little bit.
Thank you.
Joe, Barton Chronicle.
Hello. I'm not sure who should get this question. It isn't completely a state matter, but I'm curious as to whether anyone has heard about the progress of the payroll protection loan from the Small Business Administration. Are businesses getting these loans? Are people getting paid their salaries because of them?
I wonder if Commissioner Pichek might be on the line, or Secretary Curley.
This is Secretary Curley. I'm happy to take this one. Can you hear me?
We can.
Okay. So yes, we are hearing that people are being approved for the PPP. I'm hearing that actually the turnaround was very quickly, and that folks are being approved for, generally, I think, amounts that they anticipated they would be.
Just as a
might have missed part of it.
just as a follow-up, are there? I know that many banks were saying that the amount of money available would not be enough to cover the need. Have Vermont businesses hit that limit, any of them?
I am not aware that we've hit that limit. I do know that that's a concern. I think that's a concern for all of us, just knowing what the broad need out there is looking like. But right now, at least for the PPP, I have not heard anything that would indicate that we have run out.
Joe, if I can answer part of that, I believe I'm correct in this assumption that this was a collective effort across the U.S., a $350 billion limit, a first come, first serve. It wasn't allotted to individual states, I don't believe. This could be a benefit to Vermont in some respects because we're smaller, more nimble. We have a great relationship with the banks. I know Commissioner Pichek with the Bankers Association was on this early, and we made sure that we took care of any questions they might have so that we could allow businesses to apply. And we hope that has provided some benefit to businesses in Vermont. I have spoken to Congressman Welch, Senator Leahy, about my concerns and desires in terms of expanding this and trying to allot more money for this much needed program throughout the country. But what I'm cautioning them is that and we're trying to develop or gather some data on this and some suggestions on how they can improve the process, because there are some stumbling blocks within the SBA itself, and we want to make sure that if there's anything that we can do or they can do in terms of legislation when they do allot more money, because I believe that there's a desire on the part of Congress to do so, that we do it with the fixes in place as well, to create as much flexibility as possible so that there are different sectors that can be involved. For instance, some in the restaurant business aren't able to take advantage of this for a variety of reasons. I know in agriculture as well. So expanding this and providing more relief, more money, as well as more flexibility, I think are key. But let's get it right before we rush to put more money towards something that may not be working for everyone.
Thank you very much.
John Walters, Digger. John, *6 to unmute.
Yes. This is a question mostly for Secretary Smith, I imagine, regarding testing in the prisons. On Friday, you said that you don't have all the tests in the world, which is understandable. Nobody does. Can you say how many tests you have, or how many per day is your capacity, and what is prioritized over universal testing in the prison, given what Dr. Levine said earlier in this briefing about the fact that we're not seeing very many cases in the general population, mostly in places like prisons?
Yeah. John, let me just start by sort of laying the groundwork of what we've done and what we intend to do. We'll continue to test. Actually, I said this last Friday, I said I would like to test all 600 plus thousand Vermonters on a daily basis if we could. but we simply can't. There are two things that you got to remember about testing. And by the way, we're fourth in the nation in how many tests that we administer on a per capita basis. Fourth in the nation. I think the only one in New England is Massachusetts that may be ahead of us, but I'm not positive about that. But fourth in the nation in terms of what we're doing. Two things about testing that you alluded to. We have about we have a robust testing system thanks to some ingenuity, thanks to a lot of hard work, and thanks to some creativeness by Vermonters here and elsewhere, that we've turned a very, very scant testing system into a pretty robust testing system. The second thing is that you would have to, for certainty, without a sort of a COVID positive case, you'd have to test every day to make sure that you're not missing something along the way. And like I said, I'd love to be testing 600,000+ Vermonters. To get to your question, we've expanded testing beyond what any other, I think, what any other state is doing, but certainly beyond the CDC sort of requirements, when on Friday we started opening it up to those vulnerable populations, nursing homes, corrections, those with disabilities and disabled that are in sort of residential care, residential treatment facilities, assisted living facilities. We have expanded that capability in terms of what we have done. Now, I did say on Friday we are not unlimited in our testing capability. And I think we're gearing up to about 1,000+ a day in terms of our ability. But with that said, just think of what we've done over the last week. We've tested a correctional facility. We've tested and that's on a daily basis, I think. We've tested a correctional facility. We've tested now 2 long-term care facilities. This is ramping up on us, and we want to make sure that we have testing capacity in our system. And like I said, we're going to be proactive in our testing. If there's a COVID positive case, we will continue to test in a very aggressive way. Hence, sort of, although there's no COVID positive cases at the Veterans Home today, we're testing the Veterans Home, primarily because they had a case on March 15th.
If I could, I'm just going to offer as well, because there's a lot of credit due to the health department and the testing ability and looking outside the region for relief. As you remember, just 5 short weeks ago, we had the capability of testing less than 100 at that point in time. In the early days, we could only test up to 100. They expanded that within the department itself to double that, to 200. Then we reached out and found another place where we could have testing done, and that was Mayo Clinic. And then we were flying up to 500 or 600 specimens every single day to Mayo. We are now working with UVM Medical Center and others and trying to utilize a testing institute, broad testing in Boston, and that could give us up to 1,500 tests per day. So they've improved greatly, dramatically, been trying to think outside the box and trying to find more capacity, because it is part of the answer. We've known that, but we are limited by our ability and the resources we had available.
Governor, could I also mention, because this is important, I think, and Dr. Levine, I'm not trying to be an MD here, so please step in if I overstep my boundaries here. But when you're talking about testing, you're talking about 2 components. You're talking about collection units and you're talking about extraction units. Collection units are those swabs that take place if you're being tested. the swabs that you use, the tubes that they go into, all that sort of testing. The extraction unit is taking that information or those swabs and then analyzing whether you have a positive or negative. I just want people to know when we're talking about the 1,000 plus and getting close to 1,500, we're talking about those testing capabilities at the extraction level, and I want to make sure that people understand that.
I'll just pipe in with one additional point. There are some societies, some nations in Asia that actually tested extensively in their populations, often pairing it with GPS knowledge through cell phones, etc., of where positive people were and making sure that they were out of circulation, so to speak. I don't envision that happening in Vermont, but at the same time, we're certainly not putting any barriers up to testing. And I think we've succeeded pretty well in getting a lot of testing done. An interesting experiment will be happening at the Veterans Home, because though we are testing because they had a positive in March, we're not aware of any patient or staff that are symptomatic with COVID. And of course, this will be voluntary for the staff, but it will be very interesting to see if there are positive people who really don't have symptoms, or we're picking up pre-symptomatically in a large facility like that. And that will be very instructive. The governor has all along been saying everything we're going to be doing is data-driven and scientifically based, and this is the kind of data that will be very instructive to looking into the future about how we'll approach these facilities.
I guess I can understand, I can understand that testing resources are not unlimited and that a lot has been done. At the same time, I have heard before the rationale that, broad testing is of limited use because you never know when someone might contract COVID, and as Secretary Smith said, ideally you'd want to test every day. But isn't there a lot of value in at least having a snapshot? I mean, if you have testing that shows that there are no cases in prison X, then you can institute very severe restrictions on movement and interaction and have some basis for hoping that you have eliminated the chance for an outbreak. And isn't that better than flying blind, which is kind of what we're doing now?
Right. My basic answer to that is it would not actually impact anything that's being done, because all of the things you'd want in place with regards to who's in contact with who's tested on their way into work, who gets their temperature taken when, all of those things are happening in the presence or absence of testing. So I don't think the knowledge that testing would provide would create anything different with regard to how we're already trying to do all the things we do in society in Vermont within the walls of a correctional facility to the best of our ability. Do you agree with that?
That's fine. Yeah.
Thanks.
All right,
All right, thank you.
Guy, Paige. Guy Page. Okay, we're gonna move to Mike Donahue.
Can you hear me?
We can.
Okay. Two questions. First one concerning the Vermont Veterans Home. As you mentioned, a staff member tested positive on March 15th, and just wondering why it took a pretty direct and lengthy letter from Senator Dick Sears and Brian Campion from Bennington last Friday to actually implement the test down there at the Veterans Home when it's been a full month now. And why weren't the tests before that?
I'll let Secretary Smith answer that, but I would add that the letter wasn't completely accurate. There was some some misinformation within the letter, and that's not what actually drove us to where we are today.
You know what the misinformation was?
Yeah, that 3 people that had passed away weren't tested for COVID-19, and in fact, they were tested for COVID-19 and were negative in the COVID-19. So let me, Mike, this was something, there's been several, if not a half a dozen, both patients and staff that have been tested down there and proved negative. The one person who has tested did all the protocol that was required at the time. This was mid-March. You got to remember, it seems like eons ago, but it was mid-March, and the protocol at the time was to remove yourself from that institution and to self-isolate from that institution. No one else, and either showed symptoms, or if they showed symptoms, we tested those people, and everyone proved negative except this one person on March 15th. So all the protocols were in place. I do want to say the Veterans Home down in Bennington has done a very good job at trying to make sure that they mitigate any sort of situation that has occurred down there. Now, in terms of why they weren't universally tested, you got to remember in March 15th, we weren't universally tested. Actually, on March 15th, we were worried about how many test kits we had in terms of being able to test. But now we have opened that up to universal testing when there's a case or cases dealing with nursing homes in particular, or long-term care facilities, more aptly put, more long-term care facilities. We have opened up the testing far beyond what is recommended elsewhere in terms of testing. So we took advantage of that. We said, let's go ahead and test at the Veterans Home, even though that March 15th case is way outside sort of the period where you would be watching for COVID-19, and that's what we're doing today.
As a follow-up, unrelated, we're hearing that there's still problems up there in St. Johnsbury. There's a shortage of staffing. There was one report that Guard recruits have been taken out of the academy class before graduation and put to work up there at St. Johnsbury. They're not fully trained, maybe. Reports that they have inadequate clothing, like one shirt, 3 pairs of pants. They're expected to stay at the Comfort Inn and eat. And then the biggest concern is because they're probationary employees, they don't have any health insurance. And I'm just wondering how much of that is true or untrue, or what's floating out there in the community. You can put
Mike, I have not heard that. I know that we cut a academy class short, primarily. That happened a few weeks ago, primarily as we started to get ready for the COVID-19 surge response as we move forward. But I have heard none of that, but I will check on everything that you just mentioned right now.
So are they working, the recruits that were cut loose early?
Yeah, I don't know the answer to that, Mike, but I'll find out.
Thank you very much.
That's everybody. So we're all set for today. Thank you, everyone.
All right, thank you very much for tuning in. We'll see you on Wednesday.